A patient is gaining weight despite eating less, feels constantly tired, and cannot tolerate cold weather. Another patient is losing weight despite eating more, feels anxious all the time, and cannot tolerate heat. Both have thyroid disease, but in completely opposite directions. This is hypothyroidism versus hyperthyroidism, explained. The easiest way to understand thyroid disorders is through one concept. Hypothyroidism slows metabolism down. Hyperthyroidism speeds metabolism up. Everything else follows from that. Let's start with causes. The most common cause of hypothyroidism in iodine-sufficient regions is Hashimoto thyroiditis, an autoimmune destruction of the thyroid gland. Worldwide, iodine deficiency remains the most common cause. Hyperthyroidism, on the other hand, is most commonly caused by Graves' disease, where antibodies stimulate the TSH receptor and continuously drive thyroid hormone production. Now let's compare the symptoms. In hypothyroidism, metabolism slows down. Patients develop fatigue, lethargy, weakness, and reduced activity. They gain weight despite decreased appetite. They become cold intolerant because heat production falls. The gut slows down, causing constipation. The heart slows down, causing bradycardia. Skin becomes dry and coarse, and reflexes become sluggish. Myxedema can produce facial puffiness and periorbital swelling. In hyperthyroidism, metabolism speeds up. Patients become anxious, restless, and hyperactive. They lose weight despite increased appetite. They develop heat intolerance because excess thyroid hormone generates more heat. The gut speeds up, producing diarrhea. The heart races, causing tachycardia and palpitations. Skin becomes warm and moist, and reflexes become brisk and hyperactive. Now for the most tested part, laboratory findings. For both conditions, the best initial test is TSH. In primary hypothyroidism, the TSH is high while T4 is low. The pituitary is trying to stimulate a failing thyroid gland. In primary hyperthyroidism, the TSH is low while T4 is high. The excess thyroid hormone suppresses pituitary TSH production. Finally, treatment. Hypothyroidism is treated with levothyroxine replacement therapy. Hyperthyroidism is treated with antithyroid drugs such as methimazole, symptom control with propranolol, and sometimes radioactive iodine ablation. The key takeaway is simple. Hypothyroidism slows everything down: cold intolerance, weight gain, constipation, bradycardia, and fatigue. Hyperthyroidism speeds everything up: heat intolerance, weight loss, diarrhea, tachycardia, and anxiety. Remember this one rule: hypo equals slow. Hyper equals fast, and you'll answer most thyroid questions correctly in seconds. This is the Why Medic. Subscribe for more high-yield topics.